To make sure we're not wasting your time, I want to get in quickly to the details of what is going to be provided in this video. We're going to be talking about screen time, how it affects mental health, how it affects cognitive and social development, as well as how it could be potentially contributing to the diagnosis of autistic spectrum disorder. My name is Dustin York. I am a clinical mental health counseling student intern that's currently practicing in the state of Florida. And what I wanted to do is just provide some information on this topic because I've run into some folks who are experiencing difficulty with behavior of their children, and screen time. So one of the first things I want to touch on here is that Medline Plus, a U.S. government website, states that most children spend about 3 hours a day watching TV. Added together with other types of technology, they estimate that children spend somewhere between 5 to 7 hours per day in front of the screen. I find this interesting because I talk to a lot of parents who believe that their kids spend maybe an hour or two a day, and then when they start to actually do some tracking of that information, they find out that the number is much higher than they originally thought. The other thing that's interesting is that there was another study by Aziz et al. That conducted over 200 toddlers and preschool children and discovered that there was a relationship between high screen time and those children having a diminished capacity as far as their language development was concerned. Another interesting study around this screen time activity is Zhao et al. Conducted a review of data of over 5,000 children ages 9 to 10 and discovered that 7 or more hours of screen time per day contributed to increased depression and anxiety 2 years later. What was really interesting with this study, and you can see the links to all of these studies below, is that they actually they did brain scans, MRIs on these children as well. And after that 2-year period, they discovered that there were actual differences in brain structure between groups that got more screen time and didn't. And what made that even more concerning is that the comparison of the structural adjustment that they saw in the high screen time kids were actually similar to brain scans and patterns that they see with other maladaptive behaviors as well. And that was at 7 hours of screen time. And like we said earlier, Medline Plus says that we're somewhere between 5 and 7 hours a day of screen time per kid. One thing to keep in mind is some of that screen time could be well observed quality screen time that's not getting into things that could be damaging to children, but some of it could be. So another interesting study that UCLA conducted in 2014, it demonstrated that 5 days without screen time actually improved nonverbal assessment of emotional cues. So they had kids that were having issues, and after 5 days at a camp, they discovered that they were doing better. That study was interesting because it was 2014, 10 years ago, and they estimated that the screen time for children was already at 7.5 hours per day. So the next thing I want to touch on here is autism, and more specifically, autism spectrum disorder. Two meta-analysis from 2023, and a meta-analysis is just a fancy way of saying some people took the time to review all of the scientific literature, or not all of, but a good chunk of scientific literature related to research that's been done on screen time and autistic spectrum disorder. And so we basically had two studies that provided completely opposing points of view. So Ophir et al. Stated that no statistically significant correlation existed between screen time and ASD, while Sarfraz et al. Stated that screen time critically impacts neurodevelopment and puts children at higher risk of developing ASD. So it's interesting that we have these two completely opposed viewpoints on meta-analysis that were conducted in the same exact year. And it leaves a lot of us confused and wondering, what does this mean for the science, right? So one of the things I'll point out is that the DSM-5, the diagnostic manual that's utilized by most therapists, psychiatrists, psychologists to diagnose mental health conditions, talks about two specific key areas for diagnosing ASD. And the first piece, it talks about deficits in social communication and interaction. And then the other one, it talks about restricted patterns of behavior, interest, or activities. So very, very rigid. And so if we look back at just what we reviewed here briefly, and there's hundreds of peer-reviewed journals that have been, articles that have been published in journals that go into this information and talk about these relationships. But what we can see is that if we're talking about children having a diminished capacity for language, right, that's going to create some kind of social communication issue. If we're talking about children that can't effectively read emotional cues, we're also talking about, patterns of behavior that realistically could lead to or lead a clinician to providing a diagnosis of autism spectrum disorder. So I think it really depends subjectively on how people are evaluating the information that they have in front of them. We could say that there's a strong connection between this screen time and autistic behaviors, but we can't definitively say, okay, screen time exactly causes this item to happen. But what it does mean, I think, from a stance of people evaluating screen time for their children and even evaluating screen time for yourself, is that there is an undeniable connection between these items. So realistically, like I said, everything that I've referenced here is going to be available below so that you can go look at the scientific articles yourself. I'm really curious to know what people think after viewing this. How do you feel about your screen time? How do you feel about, your child's or your children's screen time? What do you think are reasonable levels of screen time that people should have? And are there certain types of screen time that maybe are better than others? I know a lot of us spend tons of time in front of the screen for work, and we're using it to process thought and work on some pretty complex tasks. So I'd be really curious to hear what people think. So provide some comments and let me know. Thank you very much for your time. I hope you found this to be a helpful video.